What is the Ebola virus? Well, the Ebola virus, it causes a severe, often fatal illness, with 60% of those infected in the current outbreak dying. It's transmitted by direct contact with blood, body fluids and tissues of infected people or animals. Initial symptoms include fever, muscle pain and a sore throat, which can lead to bleeding and damage to the central nervous system. There is no cure. However, early treatment, such as keeping patients hydrated, can significantly increase the chances of survival. So what's the current situation? Well, according to the latest figures from the World Health Organization, there are more than 1,000 cases of Ebola across 4 countries in West Africa. 672 people are dead. Guinea has been the worst affected, with 427 either confirmed or suspected cases. Of those, 319 died. And in Sierra Leone, there have been 525 people infected. Just over half have died. In Liberia, there have been 249 cases and 129 deaths. A Liberian government employee showing symptoms of the disease was detained by health officials when he arrived at Lagos Airport in Nigeria. He died on Friday at a private hospital which was evacuated and quarantined. Health officials here say the risk to people in the UK is low, but the country must be prepared. The Ebola virus enters the human population by transmission from infected animals like fruit bats and chimpanzees. It's then passed between humans via direct contact with blood or bodily fluids. There is no vaccine, no treatment, and the virus kills up to 90% of those infected. It was first recorded in 1976 in what is now South Sudan and in the Democratic Republic of Congo, near the Ebola River, which gave the disease its name. Since then, it's killed more than 1,500 people in outbreaks in the DRC, Sudan, Gabon and Uganda. But it's now affecting West Africa for the first time, and it's on a whole other scale. The doctor who first identified the Ebola virus told us it's time to declare a state of emergency.
The outbreak in West Africa is unprecedented in the history of Ebola outbreaks, because it involves 3 countries at least, capital cities, multiple sources, and that will make it far more difficult to control. What I think is needed now is a massive information campaign, but not just facts, but involving community leaders, the media, the local media, more than disease experts.